Do you have chronic headaches? Do you feel dizzy? Do you feel foggy in the head and you can't think straight? Does your head always feel too heavy for the neck, like a pumpkin on the stick? Do you have chronic neck pain in the base of the skull? These are all signs that somewhere along the line you had an injury. Now the picture you see above us, this structure right here is the second cervical vertebra, and this structure right there is the atlas. Those are the top two vertebrae in your neck, and this is a cross section through the neck. And what it's showing is all those white areas, those are ligaments. There's a lot of ligaments in the upper neck that give it stability. When you have an injury, whether that's a whiplash car accident, a sports injury, a slip and fall where you bounce your head off the concrete, any blunt trauma, because the head weighs 10 to 12 pounds and the vertebra it sits on, again, which is right there, is the atlas. The structure is held together by these strong ligaments, but when you have blunt trauma, it can tear the ligaments. And when you tear ligaments, especially the joint capsule, which is the one that gives the joint stability, and it misaligns, you lose motion in the joint. And when you lose motion in the joint, several things happen. Feedback from the joint surface back into the CNS doesn't work right. And when you have ligament injury, you get proprioceptive input from the ligament damage, which can cause pain, and it also can cause the instability, can cause the body's intelligence to clamp down. All the muscles in the upper neck lock down to try and take over for what the ligaments can't do anymore. So lots of chronic health problems are coming from this biomechanical injury, which affects the spinal cord, blood flow into the brain, venous drainage out of the brain, cerebral spinal fluid flow that's going between the brain and through the cord. And there's a delicate balance in this area which controls all of these physiological factors. And an injury, if you're someone who had an injury and ever since that injury you have all sorts of chronic health problems and you keep going to doctors and they keep giving you drugs, it's never going to solve this structural problem. So what can you do about it? Upper cervical chiropractors take 3D imaging of the upper neck to look at the joints to see how it's out of position. Everyone's out of place differently. And once we know how it's off, a very precise correction with no twisting, popping, or pulling is made to restore normal motion to the biomechanics. And over time, the soft tissue can heal and repair and your central nervous system is going to function better. So if you're someone who's dealing with a lot of the problems I mentioned earlier, please leave a comment in the comment section below and we'll try and find you someone in your area.